Alright, so today we're going over a static manual release of the iliopsoas muscle, or otherwise known as a soft tissue mobilization. The reason we're doing this today is for a patient who may be suffering from an anterior pelvic tilt, which is leading into like low back pain. The iliopsoas muscle is a postural control muscle, and when it's tight, it can help lead, or it can lead to problems with an anterior pelvic tilt due to it being tight and shortened. So today what we're going to do is we're going to have our patient laying here on the table. I understand that this isn't a patient table. This is a wooden table that I have at my parents' house. So what we're going to do is we're going to start with our bony landmarks here. So we're going to go ahead and palpate for their ASIS. You notice that we have the patient with their feet on the ground. This is so that later we can have them move into hip flexion, so I can identify the muscle as the iliopsoas is a deep muscle. So what I'm going to do is I'm going to identify her ASIS muscles, or ASIS bones, and I'm going to go ahead and palpate near her belly button here. And I'm going to have her take a deep breath in, and then as she releases the breath, I'm going to dig my fingers in because the muscle is deep. And so then with that, I'm going to actually have her push her knee up against my arm. And as she does that, I'm going to constantly release and then go back in and have her push against my arm again until I can identify the structure. The structure can be identified as like a tube-like structure that you can feel underneath the skin, deep to the skin. So now that I can palpate the structure, I'm going to actually hold on the structure, and there will feel a dense muscular body under there, and you're just going to push against that. And as you're pushing against it, you're going to wait to feel a release. And as you're holding it, you can slowly feel as the muscle is beginning to release under your fingertips. See, do you feel that? Yeah. So as it's releasing, we're just going to keep waiting, keep waiting, keep waiting. If you find a trigger point under here, it can be quite tender in a patient that has an anterior pelvic tilt because of the tightness of the muscle, and trigger points develop in tight muscles. So now that it's beginning to release, I'm going to hold it for a few more seconds. So then with this type of release, we're going to also be wanting to be cognizant of some things that can be going on in here. If you're palpating through there and you feel some pulsing, you want to get off right away, because it could be an artery that you're pinching off, and it could be one of the big arteries that will have large problems leading on later on in life, or actually that day if you're pinching it off. But also, if she's feeling tingling going down her legs, that means you're pinching a nerve. So you want to get off that as soon as you can too.